All right, I don't see anyone still connecting to audio, and I want to make sure we have enough time for all our wonderful content today. So I'll get started on this introductory part, and of course, if people join during that, that's fine. Welcome to our session today, the fourth session in our Staff Satisfaction Surveys Learning Collaborative. We're so excited to be here this penultimate session. We have some great speakers, so we're excited to get to that. Today we'll be talking about alternative staff satisfaction survey options, including qualitative and national surveys. Before we get started with that content, we'll just, remind you of some of the stuff you already know. We're your hosts. I'm Helen Ray Vernier, Suzanne is here, and Mariah is here. We're the folks here from the Star Center team, and of course, we're glad to have you. As usual, we'll go over just some housekeeping. You all know this already, but just to reiterate, do remember that the session is being recorded and the recording will be posted on the discussion board so you can access it at a later date. Please be present and if possible, be on camera. This is especially important in those breakout sessions. So we really encourage you to have your camera on when you're interacting with your peers. Feel free to use the chat box or unmute yourself to ask your questions, share your comments or thoughts throughout the presentation. And then of course, send a message directly to Mariah if you're having any technical difficulties. And then as always, please fill out the evaluation. It really helps us, it helps our speakers, and of course, BIPIC loves that. So please do that. As a reminder, the goals of our learning collaborative are for folks to learn from the materials and the expert faculty as well as each other, share your challenges and your strengths, be willing to arrive with questions and be open to that discussion piece. And we hope you leave with knowledge, new ideas, and updated processes, and then of course to develop and implement a strategy. Again, you all know this is our fourth session. We've been through this, but we have all these different tools that we're utilizing as part of the learning collaborative. And again, as we get close to the end of the learning collaborative, we want to remind you that we are available for technical assistance if you're having trouble and you want to just reach out for, to just chat one-on-one, and we will be doing a 3 to 6 month follow-up. So just a reminder to be ready for that. Our agenda for today is to do another icebreaker. This week we're doing random geography knowledge, so break out those geography knowledge hats that you've been keeping somewhere, I don't know. And then we'll do some homework review and reflection in breakout groups as usual, and then we'll have our presentations from our guest speakers, and then we'll go over wrap up and next steps. So as usual, you can access the quiz this week by going to menti.com and entering 57748895, or by just holding up your phone to that QR code and then with the camera functioning and then clicking it and going to the link on your browser. I'll give everyone just another moment to get there. Maybe give me a virtual thumbs up once you're there, or you can also access it in the chat as Suzanne has just shared. But I'll go down. I see some thumbs ups. Great. We'll go to our Mentimeter now. All right. Okay. Oh, it's loading. First, we want to go to question 1. Except it's not showing my questions.
It looks like you have to hit enter to start the countdown.
Oh, you're right. A countdown. Okay. All correct. Great. Which country has the most islands? And your options are Canada, Indonesia, Sweden, or New Zealand. I didn't know that I had timed these, but that's great. It means we can't linger too long. You have 13 seconds. This is a no stakes quiz. Just take a guess. Okay. Nobody gets right. What fun. That's exciting.
Indonesia.
It's Sweden, fascinatingly enough. But yeah, I put a lot of countries that have a lot of islands. I made it hard. All right, our next.
I would not have guessed Sweden.
Right? I wouldn't have either. Our next.
I'm participating because I want to.
Where is the only tropical rainforest in the United States? And this one you just type in your answer, and I made lots of different versions of this correct. Yeah, 10 seconds. Again, no stakes. It's just for fun. 3, 2, 1. We've got Hawaii, Washington, Puerto Rico. The correct answer is Puerto Rico. Great job, whoever did that one. But also all good guesses. All right. And the third question is, get more points. I don't know what that means. What's the name of the deepest point in Earth's oceans? The Tonga Trench, the Marianas Trench, the Kuriles-Kamchatka Trench, the Mario Sunshine Trench. Wow, great job, team. The only one that's not a real trench is the Mario Sunshine Trench. All right, cool. Great job, everyone. Wonderful job. Incredible. Way to have that ice broken. Look at all those points. Incredible. Great job. All right, and with that, we will return to our presentation and maybe, no, just kidding. Oh boy. Okay, and now we'll return. So yes, you all know this already. Sweden has 221,800 islands. Älvdalen National Forest and the Marianas Trench. Great job. So now we're going to send you into breakout groups. Again, as usual, you just have 10 minutes to quickly reflect with your peers on the homework from last time. So those action plans for responding to staff satisfaction surveys. We'll put these questions in the chat as well. But we want you to think about what's one thing you learned by completing this assignment, what's one challenge your team might encounter by responding to a staff satisfaction survey. And if you have responded to one before, what's one thing that you'll do differently in this time. So I'm going to stop sharing and then we'll send you to those breakout groups. I will put these questions in the chat really quickly. And as Suzanne says, you'll have until about 1:20 Eastern. So enjoy, feel free to chat, reflect. Learn together, collaboratively, as it were. Right, welcome back, folks. We'll give the people in other breakout rooms just a moment to return. Cool, welcome back, folks. We're just waiting on a few, I think 2 more people to return from breakout rooms. Or no, I think, is that everyone? All rooms are closed. Okay, great. Welcome back, everyone. I hope that your time with your peers was constructive and good. Of course, feel free to share anything into the chat that you want to about some of the reflections that came out of that. And while you're doing that, I will introduce our guest speakers. So we have 3 guest speakers today, 2 from CHC Inc. and 1 from JSI. Amanda Schiessl is the project director / co-principal investigator of HRSA's National Training and Technical Assistance Partners on Clinical Workforce Development at Community Health Centers Inc. or CHC Inc. / the Weitzman Institute. In this role, she leads CHCI's work in creating, implementing, and executing free innovative training and technical assistance nationally to health centers in the key areas of training the next generation, transforming teams, newly expanded to emerging issues such as COVID response, and is soon to launch HIV prevention TTA. Megan Coffinbargar is the 2021-2022 Administrative Fellow of Community Health Center Inc. And in this role, Megan works closely with senior leadership, assists in executing strategic projects, and learns skills from those around her to become an effective healthcare leader. And then finally, Stacey Moody, who will be speaking later, joined JSI Colorado in 2013 and specializes in community health needs assessments, program planning and implementation, strategic planning and facilitation, policy analysis, and training and technical assistance on enrollment in public health coverage, health center program compliance, and value-based payment. So with that, I will hand it over to our colleagues at CHC Inc. to present.
All right. Hello, everyone. I'm really excited to be here with all of you. As referenced in the introduction, just some additional context. We have Bianca Flowers on. She is our new project manager, as I will still be the project director and co-PI, but I have assumed the role of Deputy Chief Operating Officer. Wow, can't talk today. Luckily, Megan is really the star of today's show, and I am just here as a supporting role. Megan has been leading these efforts. She's been doing incredible work at CHC and has a plethora of knowledge. But to start today's session, just a reminder, and the introduction did this well. So we're talking today about our efforts with listening sessions, but we really focus on team-based care, training the next generation, and emerging issues. We provide free technical and training assistance, just like our fellow NTAP on the call today. And there's lots to be offered. So take a look. We have lots of webinars coming up that I really encourage you to take a look at. But today, just to frame up our conversation, when Suzanne came to us, as you can see, our efforts are really focused on that clinical workforce development. So when we think about recruitment and retention in this pandemic environment, we really wanted to be attentive to a lot of factors, and the listening sessions has been really our main priority and focus during this, what we're calling, COVID and, after COVID and beyond this landscape. So we felt that this was a really great approach, and I'm excited to share it with you as we think long-term, it has huge impact on retention. So the objectives of our presentation today is to present the structure for the listening sessions and the benefits of hosting them from our perspective, how to implement those strategies and the best practices we've learned, so you don't have to make the same go over the same hurdles that we had to, and then really strategies to review outcomes, create action items, and developing discipline-based improvement projects. So we're excited to share that with you, as it's a tangible thing you can take with you. And so Megan, I'm going to pass it on to you, and you can just say next.
Sure. So the first question you might be thinking are, what are these listening sessions? So at CHC, we define listening sessions as just meetings with staff and leadership, where staff just have an open forum where they can provide feedback, opinions, either negative or positive, and also bring solutions to leadership to consider. So next slide. And then also, what is the value? So listening sessions are valuable because they provide a bridge between leadership and staff that can help to build trust and also increase engagement. So these sessions are particularly important because they can be used as a way to support staff, and they can also spark change after challenging pandemic times, like Amanda talked about, by hearing really firsthand what staff are experiencing. And then we also think that they may increase retention over time, but that is obviously to be determined. So maybe we'll come back later with that result. So we have 3 models of leadership listening or listening sessions that we'll be going over today. So first are one-on-one listening sessions. So these are private sessions between one staff member and one member of the leadership team. Second are leader-to-leader sessions. So these are meetings between one member of the leadership team and a chosen leadership facilitator. So at CHC, we identified those facilitators as our director of HR and our chief behavioral health officer as these leadership facilitators. And lastly, our department listening sessions. So like the name states, these are group meetings with all department staff members and select members of the executive leadership team, such as the CEO. So first, we're going to go over the setup. So the first step in carrying out these sessions is preparation. So we recommend using SurveyMonkey as a way to both identify leadership availabilities to facilitate these meetings, and also as a way for staff members to sign up for sessions. So we recommend that each member of the leadership team sign up for 5 30-minute sessions to facilitate.
And something really important that we want to just kind of nail home here is that those 3 different opportunities, well, we did all 3. We're not saying you should do all 3. In typical CHC fashion, what we've provided for you is a menu. And you might be thinking to yourself, you know what, our leadership right now, they need a space. Then go for the leadership to leadership. If it's, your staff just want to be able to talk to people one-on-one it is, or do you really want to take this as a big initiative, take it departmental? So really think about that, because I know you don't have all the resources. It was a massive lift. This was 100% supported by our CEO. And so we were able to do all 3, but we understand that the reality is you have tons of competing priorities. So I don't want to lose you while we're presenting this to think, wow, this is too much. This is really a piecemeal, and it's a menu of options that we encourage you to take on, because our staff they've been very positive about these experiences.
Mm-hmm.
Go ahead, Megan.
And most of these sessions are set up in a similar fashion. So you can see here for the leader to leader session setup, it's pretty similar to the one before. So we recommend that each leadership team member facilitator, so in CHC's case, we had the director of HR and the chief behavioral health officer. They choose 5 30-minute time slots to meet one-on-one with a member of the leadership team. And then next is obviously the execution. So for both the one-on-one and leader-to-leader listening sessions, facilitators were sent listening session instructions. So a list of, tips and tricks to go over before they actually do the session. So, for example, if a staff member brings up, a very personal issue or a very extreme issue, where should they go for support, both as to support the staff member and also to support the leader facilitator. So things like that were included in the instructions. Leaders were also sent a list of questions to ask each attendee. So we had a list of 4 or 5 standard questions just to set the groundwork for giving that opportunity for staff to open up. And then we also used an Excel template for leaders to use to take notes. And those facilitators sent those notes afterwards to a designee, which was me, to compile those themes and also present it back to leadership so they can, consider those opinions or those solutions that staff members had ideas on and go from there.
And then I think it's me now. So speaking about the department listening sessions, this is our 3rd of the 3 from the menu that we talked about. And this is really a greater, larger open forum meeting for departments. Same exact strategy, same exact outcome and goal. But the reality is, the decisions on how to determine what departments are is based off of the size, right? Our operations team was huge, so they, split it up between a lot of different opportunities. Facilities was in the morning because facilities were more likely to be available at that time. So really thinking about those unique aspects to what you would deem a department. Really important for the infrastructure that Megan and the team really figured out, instruct note takers to collect feedback during the meeting. Really important. That is the meat of what you're trying to take and create into action items. Assemble a task force to compile those action items based on the feedback. Take the feedback and make it into actionable things that you then can give to leadership. And from that then creates a project plan with timelines and owners on that actionable feedback. Create the tool with headers from the forum to aid in that, though, to allow you to have a lot of processes that are streamlined across all of the department listening sessions as you do it. To keep in mind, we started this by focusing on specific departments and then slowly over time, expanding it to other departments. So don't try to do all of them at once. This is really something that is resource intensive. So you want to put in the time, you want to be intentional, and you want to be clear about that you're devoting the time to this department, so they don't feel like you're stretched then. So you want to schedule 2 30-minute follow-up meetings with the same departments. I think it's really important. So create a slideshow comparing the initial feedback to completed in progress and non-actionable feedback, which throughout this presentation, there's a lot of things that we're actually going to offer up tools. So we're going to offer up the slideshow with nothing in it, but for you to use as an example, organize that task force to present areas of expertise. So what I loved about what Megan and the team did is that if you are the one who are, taking action on said responses, right? I'm deputy COO. I've been doing a lot of COVID initiatives. I would join the follow-up call a month later and share, this is the progress we've made and these are our intentions. And I think what's really important is that in that you recommend that the last 15 minutes be another open forum as well. You don't want, really what we've seen and what we hope for the goal of this is to be, one, people have a space. It's been a tough couple of years, but that you're building trust, you're creating a rapport. They feel that you've taken action on their feedback, and that's really invaluable. And we think that it's really important right now, especially in this last 2 years, which has just been completely you just don't know what's going to happen next. In these department listening sessions, as I said, though, it's really important to create a safe environment for staff to have their voices heard. So you really want to make sure that leaders are responding to feedback in an authentic and realistic way, that they're being attentive, they're not. And this is really a focus for, if you bring this to your team, being very aware and intentional with them to say, if we're going to do this, let's do it right. I would not do this and halfway commit to it, because the reality is that, as I had said, you want to establish a foundation of trust with those leaders, and that will impact morale, which increasing morale is needed right now. Be open to other ways to submit the feedback. Not everybody is going to want to speak up. Some people might want to send an email. They may want to ruminate on it and come back later. We offered up lots of different avenues, and then embrace everyone's uniqueness. So allow people to be open to that opportunity. And I think really when it comes to leaders, make sure that you have robust conversations and understanding for where the workforce is and where it's going when the sessions are completed. Continue to loop leaders in every piece of the presentation. It's really important that you have the leaders buy-in, and take the executive sponsors away from the day-to-day. So what I really just want to hammer home here is that if you do think this is something your organization needs, bring it to your leadership and present really the clear lift that it's going to take, and help them understand that the reality is that doing this right will have a lot of benefits. Doing it wrong is definitely not something we're recommending. I think time is sensitive right now. And so we've been very intentional in being attentive to this process. And, based off of what leadership has told us, we ruminate on this as being authentic is something that's really rare. They spoke about, we don't want cookie cutter responses. We want clear, tangible action. And so when you give yourself a month to take action on those deliverables that came out of that first session, be very clear. This is what we're able to do and what we're not able to do, so that they understand that you really thought about it. Even if it is no, that's okay. But we always say, give them the why, and then if you can do it, the how. And then, as I had already said, encourage staff to participate, urge those who are tasked with responding to do so in a timely fashion. You will have to analyze the quality of the responses, as always. Not that is silly, we're not going to do that, isn't the right response. As we said, give them the why. And I love this, but encourage leader to leader accountability. I think that's really important, because the reality is that with this work, it does require lots of leaders working together. It does not, no one is special in the sense that it will always hit someone in your organization, and will always, some of these projects will be long-term. So you want to make sure that you can continue to be attentive to that. Now I'm going to hand it off to Megan, who's going to do some little win case studies so that she can share best practices.
Sure, thanks, Amanda. So we wanted to give you some examples of the takeaways that Amanda and I and the leadership team, learned from these sessions. So the first one is called Little Wins. So we had a department listening session with the dental department, and they really felt separated from the rest of the organization. So after listening to what they had to say, the leadership team implemented small changes that proved to have a really huge impact. So some of these changes included a stipend for them to get scrubs, increased badge access for them, some new air purifiers for their spaces, and support system improvement. So this use case really proved that little things can make a huge difference.
And a lot of these things already existed. Sorry, Megan, to interrupt you.
Yeah.
I think that was really what hit home for us was these are things that existed. The stipends were given to others for scrubs. And a lot of these things cost very little. And then they get to leave the session heard and we're actually producing something. I think that's pretty amazing. And I apologize, Megan, go ahead.
No problem. And then the next case study we have, the last one, specifically focused on burden. So a major theme in all of the department listening sessions really were feelings of burnout and also administrative burden. So one response that had a large impact on staff was leadership's simple acknowledgement of staff's feelings and experiences. So staff express their appreciation of the listening sessions, but like Amanda said, they also noted that they hope the support continues and that they actually see changes come from the feedback. So this case study really proved that leadership acknowledgement, saying that what they're feeling is valid, and leadership support can really go a long way.
And so I just wanted to let everyone know, there are the 3 different models that we spoke about, and I know the slides will be shared with everyone. We also will follow up actually with some tangible things that Megan really cultivated that are great resources. The email to our organization inviting and explaining what listening sessions are. More information about the surveys. We spoke about utilizing a Survey Monkey, the templates for the Excels, the PowerPoints. We have lots of resources we want to share. If you do want to take a stab at this, I think it's really worth the buy-in and the investment. As someone who was working out in the field during COVID, it's nice to have this opportunity and to reset. And I strongly encourage, while we don't know the long-term impact on retention, I can tell you, we know the impact on morale. And that is something that is invaluable at this time. So thank you, Megan. I thank you for all your hard work on this and, really applaud you and the efforts and hope that you all feel inspired to take on some of this work. And I'll hand it back over.
Awesome. Thank you so much. Thanks for sharing. Before we get to Stacey's presentation, are there any questions for the CHC folks?
Yeah, this is definitely an innovative approach and something a little bit different than we had talked about in previous sessions, is sort of like a traditional pen and paper approach to, implementing and responding to staff satisfaction surveys. So love to get anyone's thoughts or questions before we move on. But definitely an innovative and exciting approach to this. I have one question for you guys, if I can. So I know you said you collected all of these things and you went back and you're, obviously, responding to them and things like that. What was the process of collecting the information? And obviously it wasn't anonymous because of the type of survey that it was, or it's not really a survey, it was a conversation, frankly. Mm-hmm. How did you sort of collect that? And did you have a designated person? Was it just free form collection that they were just taking notes? How was that done?
Go ahead, Megan.
Sure. So we had kind of 2 different ways to collect the feedback. So the first way was specifically for the one-on-one staff listening sessions and also the leader-to-leader listening sessions. So we did receive feedback from staff saying, this isn't really anonymous because you really have an Outlook meeting, saying who was meeting with who. So that was one of the hurdles, that Amanda mentioned that we had to get through. So we did, simply agree with the staff saying, technically this is not anonymous. However, when we work to compile the feedback and push it back out to the leadership, that was anonymous. So the actual presentation of all of the themes did not have any names associated to it. So that's kind of the first step. And that was across the board with all of the feedback presentations that we had. So with the one-on-one and the leader-to-leader listening sessions, we had a set of questions that I went through. So a set of 4 questions that the leaders asked the staff members. And we just simply had an open space for leaders to write their thoughts and write notes during the session in an Excel sheet. So each column was a different question. And then what I did, I was the designee for leaders to send the feedback to. And I worked through, picking out really even common words throughout all of the feedback. So one of our COO's suggestion in presenting that feedback is creating a word cloud. So we actually, those themes were actual words that were repeated throughout all of the feedback notes. So that's kind of just how we grappled the hundreds of, words and sentences that we received. It was a lot to go through, but you really had to, have a systematic way to digest the feedback and also present it back to leadership. So that's how we did it.
You know what I liked about having
absolutely.
sorry, Suzanne, I didn't mean to interrupt. What I liked about having Megan do it, and if you don't have a Megan, you always have someone who's the backbone of the org. Not having it as a leader present the information, I think is really great. There's no area for interpretation. Megan presented it to us as is. And I think reinforcing that as a leader myself, it's really helpful because there isn't always a forum to get back real honest feedback that isn't through a filter or, if you know what I'm getting at, I think it's really key. So if you do this, finding a Megan, an administrative assistant, an executive assistant, might be the right move because it's helpful. Then she had them, she had smiley faces. There were sad faces, happy faces. It's very apparent what was areas for improvement and what was things we could celebrate.
Wonderful. Thank you for that description because, working with qualitative data is so different than working with quantitative data. And so anyway, just really helpful for you guys. So thank you so much for answering my question.
And then you kind of touched on this in answering Suzanne's question, but we do have a question in the chat. Did you find that staff were at all reluctant to provide that feedback?
Definitely. And I think that's with everything, any way that you want staff to provide feedback, there's probably going to be, some folks who are reluctant, but we just wanted to, tell it straight, really, how this is going to happen, how we've set this up. And, I touched on the non-anonymity piece already, we were upfront with that. But then we also said, explained why we're doing it this way. We really wanted to hear, from the staff one-on-one, just to see facial expressions and things like that you really wouldn't see in, a survey or something like that. But then we also had staff that really would rather have that, real anonymity piece. So that's something that we had talked about as well. Just maybe next time we could have this sort of session and then also an anonymous survey, maybe from an outside vendor or something. So we were listening, to staff feedback overall, about the organization, but we also listen to feedback to the actual process. So we, have learned our lessons from this, but we're happy as to how it played out as well.
Awesome. Thank you so much. Well, if folks have any other questions, feel free to put them in the chat. We'll have some time later for any follow-up final questions. But with that, we'll hand it over to you, Stacey.
Great. Thank you, everybody. I'm going to get my slides up here so you can see them. Thank you for the opportunity to speak with you today. This is a really timely learning collaborative for us to speak at. I'm Stacey Moody, and I'm a consultant with John Snow Inc. or JSI. And JSI has been contracted by the Health Services and Resource Administration, or HRSA, to perform a HRSA Health Center workforce survey that I'm here to speak about today. So as you can see, it's a very timely opportunity. And I'm going to share more about the goals and the timeline for the survey and a little bit more background on it. But I also wanted to introduce my a couple of other folks that are here with me today. First, my colleague, Ann Keene with JSI, who is the project director for this at JSI. As well as from HRSA, we have Jane Berube and Marisa Stacey, who are overseeing the project for HRSA on behalf of the Bureau of Primary Healthcare, or BIPIC. So they're here with me today and can help address any questions that we have. But thanks again for this opportunity. And like I said, it's the perfect group for us to start sharing this with. Let me move to the next slide. As I said, JSI has been contracted by HRSA and the Bureau of Primary Health Care to survey HRSA-funded health centers across the nation to assess well-being, engagement, satisfaction, and burnout. We're all working from the understanding that the healthcare workforce is particularly susceptible to overwork and burnout, and the stresses of the public health crises, including the ongoing COVID-19 pandemic, exacerbate that problem. So with that, HRSA and the Bureau of Primary Health Care are examining the issue and have again contracted with JSI to help develop the survey and then implement the survey. JSI has developed the survey, and it's designed to assess the levels of staff well-being, engagement, satisfaction, and burnout, and again, among HRSA's funded health centers across the nation. And ultimately, the goals or the data is going to help, that's collected through the survey, are going to help provide a baseline level of job satisfaction and burnout among health centers across the nation. It will allow for comparisons at the national, state, and organizational levels. It will identify areas for organizational change to improve workforce well-being, as well as it will help inform HRSA and the Bureau of Primary Health Care around training and technical assistance strategies that can be used to improve workforce well-being, as well as to help build learning organizations and communities. The goals of the survey, as I said, the survey is going to be conducted across all of the HRSA funded health centers in the nation. So our goal is to collect responses from 100% of the 1,400 HRSA funded health centers, and also to collect surveys from 85% of health center staff across all job levels at health centers. And this work in the survey, the HRSA Health Center Workforce Survey, really aligns with HRSA's strategic goals, to improve access to quality services, to foster a healthcare workforce that's able to address current and emerging needs, to achieve health equity and enhance population health, and to really optimize HRSA operations and strengthen program management. This here, so there's a couple phases of this project. This on the screen is a logic model for the survey development, which this phase of the project has been completed. But I wanted to walk through this so you can kind of see the work that has gone into the survey. And then on the next slide, we'll talk about what are the next steps and where we're at now. But as you can see from the logic model, the very first thing that we did in this was to design the framework for the survey itself, and then perform a pretty robust literature review and information gathering. During that literature review process, we did find that most of the research on healthcare workforce satisfaction surveys, a lot of the research was not within the primary care setting, or it wasn't specific to health centers. And we also found that in a lot of the research that it was focused on providers and wasn't inclusive of all the staff that may be in the health center setting or healthcare setting. So to supplement that, JSI performed listening sessions. It's ironic that you guys that we were just kind of presented on that, but we did the same thing. And so we held a series of listening sessions with different staff from health centers across the nation, and we met with them by staff role and had kind of virtual conversations about workforce well-being to them and satisfaction and burnout, really meant to inform the design of the survey so that it was designed to encompass all staff, not just providers, as well as take into account the health center context. So using that background information, we drafted the survey, and it went through various feedback loops, including not only from HRSA, but also from technical advisors. And then we moved into a testing phase once we had a revised draft. That testing phase included kind of two key components. A cognitive test where it's like an interview process where we spoke with potential respondents, so health center staff, to really get their understanding of how are they interpreting the questions that are being asked, the instructions that are being asked in the survey, their kind of understanding of the questions. And this was, again, to inform any revisions that we could make to the survey to make it most applicable to the end goals. And then we also did pilot testing with health centers across the nation, where health center staff have completed the draft version of it and provided feedback. And based on both of those, there were revisions made into what became the final survey instrument tool that is now final, and kind of moves us into where we are now, which is our next phase of the survey. Move to our next slide. So on this is showing our timeline in this current phase, and we're in the kind of on the left side of this timeline, what we call year one of this phase, the engagement and piloting process. And where we're at now, and in this first year of the project of survey implementation or administration, we're really focusing on engaging health centers in this survey and partners as well, primary care associations, the National Training and Technical Assistance Partners, and many other stakeholders that are, partners in helping to engage health centers in knowing about the survey and then filling out the survey. So we're at the very beginning set of that phase. I'd say kind of meeting with you as one of our initial, here we are, opportunities. But we wanted to build this kind of engagement where we're working on communications and marketing and engaging health centers in this, so we could encourage a high response rate. We're also doing a pilot test. This one is a little bit different than the one we did before, in that we're not pilot testing the survey instrument itself, but we're pilot testing the process for getting it out to the health centers and out to health center staff. So we can work through all of those kinks before it goes live, which happens towards the end of this year. It will begin in fall of 2022, will be the launch of this national survey that will go out from HRSA to all health center staff. It'll be in September and November of 2022. And then you can see after that, well, during that process, data collection will be ongoing and that's going to help us improve the response rate. And then we'll move into what we call the data analytics phase, which this probably all sounds familiar because it's the steps and processes that you're talking about with your own staff satisfaction surveys. But we will be analyzing the data and developing reports on the findings after the survey administration is finished. And you can see on the right side there, a couple of the reports that we will be producing are a report on the health center workforce well-being, as well as a national workforce well-being comparison report. And we also right now are working on, how to provide health center level data. And, we're currently working on how can we provide that health center level data that's meaningful, but also in a way that maintains confidentiality, which is kind of critical to this piece of it. So we're working through that process, but understand and are hearing that that's an important piece of kind of buy-in or willingness to complete the survey. So I wanted to add that on here. Before I move on to questions about this, a couple of things. One, we are getting prepared to do this pilot. And like I said, it's a pilot that won't test the survey instrument itself, but more, how do we administer this? How do we get it out to health centers and health center staff, and work through all those things. So when we launch in the fall, it can go as smooth as possible. So if you're interested in being one of those pilot sites, it won't be all of the staff at the health center that will pilot it. It will be a small number. At the same time, we are reaching out to certain health centers across the nation and asking them to be a pilot site. So if by chance your health center is one of them, we encourage you to participate in this so you can help us in the kind of administration or launch of this tool itself. I also want to add, we are in these beginning phases of the engagement process. So we are doing a lot of kind of understanding what is going to help get that high response rate that we're looking for. So some of the questions you may have today, we might not have questions yet because they're things that we're working through, but your questions may help us as we are designing kind of the launch phase of it. And I will see Anne or Jane or Marisa, if there's anything that you wanted to add that I may have missed that you think is imperative, and also open it up to anybody who may have questions.
Hi, Stacey, this is Anne. I don't have anything to add, but I'm happy to help answer questions as they come up. And Marisa, I think I saw you on the call. Did you have anything you wanted to add?
No, I don't. I think you did a great job explaining what the objective of this particular survey is, our goals. Thank you.
So I have a couple questions for you guys, and thank you guys. Thank you, Stacey, so much for presenting this. And like you said, when we were talking with one of your colleagues, this came up, and we really felt like this was an important thing to share with you all as a part of this learning collaborative. Obviously, staff satisfaction surveys are something that is the data is collected by UDS. And now HRSA is putting putting this out nationally. And so while it's just as important for you all to collect it at the local and individual level, it's also really imperative that HRSA understands what's going on sort of globally, if you will, with health centers. So as Stacey mentioned, really allowing people like training and technical assistance partners to really have that targeted technical assistance, and what can we help you all in the future. So I would just say that. Well, my question to you, Stacey and Anne and the HRSA team is, you might have mentioned this, but just kind of wondering. So two things. So obviously collecting staff satisfaction survey data is important. It's because it's important enough for it to be asked on UDS. So it's important, right? If people are collecting that. But B, how does this supplement or replace their survey during this year? Because obviously, we're asking them to collect this data, now-ish, right, as a part of this learning collaborative in a 3 to 6 month follow-up. But then we're going to ask, again in September or wherever. So how is that? How do you all see that process working? You may not have an answer, but just curious about that. And will this be something that is done again? Or is it just a one-time thing?
Great questions. And do you want me to, I see you look like you're ready to answer. So.
Yeah, first of all, Marisa, is there something, do you want to chime in on any of that first from a HRSA perspective? And I can talk a little bit about the thoughts from JSI perspective. Not to put you on the spot. So you can decline if you like, or Jane, either one of you.
No, I don't have anything to add at this point.
Okay.
Sorry, the question was if it will be fielded more than once. Was that the question? The survey?
That one of the questions I would, I think, yes, Jane, if you could chime in on that in terms of the intention there.
Yeah, the goal is that when we administer it in the fall, that we'll get some baseline data. Obviously we're hopefully coming out of COVID at that point. So we'll have some baseline data that we can go by to start thinking about how to provide the targeted technical assistance and other resources. And then additionally, the health centers will each get their own dashboard of their own data on their respective health centers. So we're really excited about that piece. The other part, as far as fielding the survey going forward, we don't have an exact schedule of how that would look. I would assume it would be every couple of years, because obviously it takes some time to implement change or to see the effects of change. So the goal is that it would continue to be fielded, but what that interval looks like is not for sure quite yet.
And Suzanne, the other thing I think I would add is that I think there is a recognition that other, surveys are being done or will be done in the future. I do think the ultimate goal is that this would become the survey of choice for health centers to use, and perhaps there's some supplemental that they could add on to that, or that HRSA might add on, depending upon kind of the environment, the current environment, so that it continues to be fresh, right? And but also provides, as Jane said, that baseline data. And then I think what that also allows to do is great comparatives, looking at, rural health centers versus urban, large, small, and across the demographics of the staff, across the a region or the country, or occupation groups. So it allows a sufficient size of data to make those cuts and those comparisons, which I think could be beneficial to both individual health centers and certainly to HRSA, to the primary care associations in the state. So I think that's the hope. It's kind of like looking at CAP survey, where you can do a comparative with your peers and really be able to dig into the data and do some things, not only individual health center level, but again at the state or regional level or national level, for as well, with the Bureau and Bureau of Primary Health Care and NAC and other national organizations. So I believe, but I mean, not to be saying like this is the best survey in the world, but I think that is the hope, is that people would see this as the survey of choice going forward for all of those reasons.
Okay. Great. And you mentioned something too, or maybe Jane did, about the dashboards. And I know that's something that's really important, is for health centers to be able to see their data as well, so that they can act upon it as well. One of the things that we learned last week, we had a speaker talking about, that they didn't just survey their staff once a year. It was, like they did it in multiple ways. And so, if that becomes, sort of the survey of choice, it's great from a national level, but then, they could also be, doing things, locally as well to, supplementive. So that's great. But, that dashboard is going to be, I'm really glad that's, I'm excited for that. So that you all, as you're implementing these and, and having your staff implement these as well, that you'll be able to get that data and use it in addition to, any data that you might have gathered on your own. So that's fantastic.
And I'll mention, Suzanne, that JSI is currently working with HRSA and their data folks as well, to when we're doing those dashboards in terms of how this will be given, the interactiveness and stuff, and what we're looking at is, as Stacey said, meaningful, but also ensuring confidentiality. So when you get down to the health center level, as you can imagine, you have to be really careful about presenting things at a small cut that could identify someone, because we do want to ensure confidentiality when staff are taking the survey. But we're looking at that very, very carefully and want to give as much data as possible at the individual health center level, while again ensuring confidentiality, and also at the health center level too, to ensure the confidentiality of the health center too. So I think JSI is working very closely with HRSA to make those determinations about how the data can be shared.
Thank you so much. This is good information and good to know that's coming down the pike. Any other questions that we have from anyone on the line about this, or how it fits in, or anything else? Awesome.
And as Stacey, said, if someone wants to be a pilot for our phase 2 pilot, please let Suzanne, or then Suzanne, you can let us know. But because we are currently recruiting, and we want to make sure that we have a good sample. So if anyone is interested, please do let Suzanne know.
Yeah, absolutely. Happy to get you all connected. Okay, awesome. Well, Stacey and all the folks at HRSA, thank you so much for joining us and presenting that and letting us know what's coming down, coming down the pike here. Really good to have a heads up, especially as we are looking for you all to implement your own, and then sort of understanding how also that feeds into, an additional ask of your staff. And sort of getting them primed. I think, as we heard last week from Tammy Green and the work that they're doing at Anchorage Neighborhood Health Centers, it wasn't just something that they just did once a year. They were sort of that continuous feedback and that continuous QI. I think, honestly, for me, that was a really big takeaway from last week. And so I think that, sort of figuring out what works, with your health center and how, we're doing our own individual thing, and then collectively, and really helping HRSA to understand that data. And I know there's a lot of data asks of you all, but I think this is a really important one to be able to help your health centers with. So, okay. So again, thank you to all our presenters, really valuable information today that was shared. And now in our last 5 or 7 minutes, we're going to go over homework and next steps before our last session. Next slide, please. Okay, so as always, we have a little bit of homework. And this homework is a lot like the homework that we had you all do on the first week. And so it's really just thinking through all of the questions and reflecting on all of the sessions that we've had so far, thinking through any, gaps or barriers or, processes as you're putting your surveys together or you're responding to your surveys, because, as we've learned, that is just as important as actually putting them together as well. So please take some time to look through that with your team. And, we would be just ecstatic if you were, and hopeful that you would be able to come and during our last session, be able to share any questions you might have, your challenges, your plans, your thoughts, anything else that you have available. So because our last session, our next session is our last session, and it's really going to be a lot of time for us to be able to sort of figure out where we go from here. And I say, where we, and I say we collectively, right? So we as a learning collaborative, we as, your teams, and we from peer to peer. So we really hope that you'll take some time to reflect on the last 4 sessions, what you've learned, what you're excited for, what you're hopeful for, and also what your concerns are. Because, part of this learning collaborative, as Helen touched on earlier, it's part of that. It's a collaborative. It's, that peer-to-peer learning. And so if you have a challenge that you're working on that you think, that you're just not sure about how you're going to get through, or, something that you've come up, whether it's, putting the survey together or how you're going to respond, we're here for you. And we really want, it's not just, Helen and I as faculty from ACU, it's, you all have just this collective brain trust, and it's our hope that we would utilize that last session to really be able to work through those things and help you all as you go to your next steps and as we finish up the learning collaborative. All right, and so thank you, Helen. Just as a reminder, you can access this recording, the slides from today's presentation, as well as your homework on the discussion board. So again, as always, feel free to message Mariah if you're having trouble logging on, or you've lost your login, or any other troubles getting on the discussion board. Next slide, please. And so with that, again, thank you so much. Our final session is on Wednesday, March 16th at 1 p.m. Eastern. Again, it'll be a lot of interactivity, a lot of sharing. And we really just want this to be a time to launch you all out into doing this on your own and answering any final questions you have, and allowing you all space to ask those questions as well as respond. Next slide, please. And so just a little plug from also some upcoming events that registration has just opened for now. So ACU Star Center is putting on 2 events in Nashville during the first week in May. So first of all is our Workforce Symposium. So that's going to be May 2nd and 3rd in Nashville. that is going to be sort of a deeper dive into workforce topics that are affecting health centers today. So we're going to be doing a variety of different sessions. We're going to have some on some JEDI initiatives, burnout and resilience, on physical and psychological safety, as well as some others. So it's going to be not necessarily a full-blown conference, but 2 days of really meaningful content, and keeping it small enough so that you'll have some time to break out, talk to your peers and things like that. And then the following 2 days on the 4th and 5th, it's going to be a much smaller group of about 30 to 40 people, where we're going to be taking folks on really putting together their retention and recruitment plans and really workshopping that. So on Wednesday, we'll do putting together a retention plan. And then on Thursday, we'll put together elements of a recruitment plan. So you'll leave that with the first steps of putting together a comprehensive recruitment plan that Vivek is asking all of our health centers to have. So just wanted to do a quick plug for that since we had some time together today. And again, registration links in there. Feel free to ask Helen or myself or any of our Star Center team about information on that, but just wanted to let you guys know. And so with that, if there are no other questions or comments, and yes, as always, Helen, lots of resources on our website. Feel free to check them out as well. And as we wrap up today, Mariah is going to pull up the evaluation, and if you all could fill that out before you go, it would be so helpful. But again, thank you all to the presenters for being here and presenting some alternative survey solutions here, as well as all of you participants for being here as well. So again, fill out the evaluation before you leave. Check out the discussion board for all things Learning Collaborative, and we'll see you back here on the 16th.